Hello lovely people, it's always a thing of joy for me to make these videos. Firstly, I want to use this opportunity to thank you for clicking on this video. You're truly a beautiful soul with a loving heart. In this video, we'll be talking about the pathogenesis of abdominal aortic aneurysm. Relax, okay? Don't let these words scare you. Pathogenesis of any disease or any health condition is simply a manner by which this disease or health condition develops, okay? So that is what pathogenesis of any disease is. So the pathogenesis of abdominal aortic aneurysm involves many factors acting over time. However, the destruction of elastin in the aortic wall is actually a key event that shifts the load produced by the blood pressure onto collagen. Let's watch out for the two words collagen and elastin. So these two words should take us back to histology, where we were made to understand that elastin is highly elastic protein that is present in the connective tissue. The function of this elastin is to allow a lot of tissues in the body to regain their shape after stretching or contracting. Collagen fibers, on the other hand, are structural elements found in vertebrates that transmit forces, store and also dissipate energy. So you might be asking, why do we always deviate when we are talking about a particular thing? We always shift from one course to another. The main reason why we deviate a little bit on the course of our discussion is because knowledge is like a building block. Okay, we add one brick of information on the foundation of the previous knowledge that we had on a particular topic in order for us to come up with a wonderful edifice of knowledge. Okay, so please bear with me. Like we said, it is the destruction of elastin in the aortic wall which ought to bring about regaining of the shape and size of the aorta after it must have undergone compression and stretching. We cause the aorta to lose this ability. Hypertension, smoking and old age can cause the condition to worsen, since elastic lamina are relatively less common in the abdominal aorta. The important enzymes that have the ability to bring about the degradation of this component of extracellular matrix in the arterial wall, which comprise not only the elastin but also the collagens, the proteoglycans, laminin and fibronectin, are the matrix metaloprotenase, which are simply known as the MMPs. So these enzymes are responsible for the collagen and other protein degradation in the extracellular matrix. Having known the things that bring about abdominal aortic aneurysm, it is important we also know the class of aneurysm it belongs to and also the size of this aneurysm. The abdominal aortic aneurysm can be circular or fusiform. I hope we've not forgotten the classification of aneurysm according to size and shape. If you have, it is not bad, okay? It is not bad. What you just have to do is to go back to the previous video on aneurysm and refreshing your memory, alright? Sometimes this aneurysm is about 15 cm in diameter and the length is up to 25 cm. Lest we forget, this aneurysm is situated below the renal arteries and also above the bifurcation of the aorta. In areas where there is complicated atherosclerosis, I hope we still know what atherosclerosis is. Kudos to you, because I trust your recollective power. So in areas where there is complication of this condition, I mean atherosclerosis, destruction of the underlying aortic media can weaken the wall. Having talked about the morphology of this condition, what then are the clinical consequences? One of the major consequences is the rupture of this aneurysm into the peritoneal cavity or the retroperitoneal tissue, and this has the ability to cause fatal hemorrhage. Another consequence is the obstruction of vessels, particularly that of the renal, iliac, mesenteric and vertebral branches, which give blood supply to the spinal cord and then leading to ischemic tissue injury. Also, embolism from the atheroma or mitral thrombus is seen also. How can this aneurysm be detected? The diagnosis of aneurysms are difficult because oftentimes these aneurysms are asymptomatic, that is, they are without symptoms. Once aneurysms is suspected, the following tests should be carried out immediately. They include chest X-ray, CT scan, MIR and endocardiography, which is simply ultrasound of the heart. Also, abdominal ultrasound should also be carried out as well. How then can aneurysms be prevented? Aneurysms can be prevented through the changing of our lifestyle. If you are someone that used to take tobacco, smoking, please quit it. Also, proper blood pressure control is important in avoidance of aneurysm. Early diagnosis can also help in preventing aneurysms. Please, it's important we note that this video is not for self-medication, okay? If you notice any symptoms of aneurysm, please visit your doctor for proper advice. This video is basically for educational purpose. Thank you so much for understanding. How then can these aneurysms be treated? Like some of us might ask. Well, the treatment of aneurysm has been through surgical procedures, although in recent years, endovascular or minimally invasive technique has been developed for many types of aneurysms. So guys, that's all we can say about aneurysms. If there is any questions that you have, you can always use the comment section. Remember that you can also recommend any topic of your choice that you're finding difficult so that we can put hands together and tackle it, alright? So see you in the next video. God bless you. God got you. Peace.